Thank you for attending today. My name is Francisco Torres. Thank you, Heather, for the introduction. So today we're going to talk a little bit about sports participation in children and adolescents. And we're going to specifically talk about the pre-participation physical evaluation. Some of the risks, the intention of this physicals or pre-participation physicals is to identify any problems, any health problems or conditions that may be affecting your child, and we want to evaluate them beforehand to reduce the risk of injuries or complications while practicing a sport or exercise. So let's get physical. The physical examinations, as we all know, is to ensure that our bodies are healthy enough for different things. In this case, we're going to focus on our children, but as we know, we get physical or clearances before getting surgeries and things like that as well. So what is a pre-participation physical? What's the intention of it? So about a little bit over half of children in the United States participate in organized sports, whether it is through a club, or school, mostly school. And it is considered standard of care that all these athletes have a physical evaluation before the start of the season. And I'm very happy that this talk was requested early on because, if your children are like mine, they show up, with that paper from the school on August 27th, right before the start of the season. And then we have to, rush to their doctor's office and get these done. So it's important to try to get them done while during the summer. That way they're ready to start as soon as the season starts after they go back to school after summer. Now, very important, the PPE or the pre-participation physical evaluation is not intended to serve as your child's comprehensive adolescent or well-child maintenance visit. This is not for vaccines. This is not for other preventive testing. This is specifically and exclusively to identify any problems that may come up with your child when they exercise or practice any sport. What are the goals? So the goals is make sure that your child is safe to participate in organized sports or exercise in general. Try to identify medical problems or that can pose life-threatening risks or complications to your child while exercising or practicing sport. Some of you all may have heard about hypertrophic cardiomyopathy. This is considered a genetic hereditary condition that generally you are born with, but may not be identified at birth if it's not severe enough. And sometimes it's not identified until later in life. So these are, some of the things that we can see when we examine our patients. We can ask for symptoms or even, effects of exercise and things like that when we see them. And when we examine them, we can hear murmurs, like a whooshing sound in their heart that would lead us to think, oh, maybe something bad is going on here. About 1% of people with hypertrophic cardiomyopathy can suffer sudden death. That's why it's important to examine patients for this. You've heard that story, oh, they were playing soccer and all of a sudden the kid collapsed and they tried to help him and they couldn't do anything. So this is a completely treatable condition if identified. If not identified on time, then the heart just keeps getting worse and more difficult to control, and that's what that can lead to heart failure and even sudden death. Now, this is not that frequent; it's about 1%, so it doesn't happen, a lot, but it is something that is preventable, and that's why we put so much importance or emphasis on this. Other conditions that may require treatment, like hernias, high blood pressure, asthma, more recently, those of us doctors that see adolescents, we have been seeing more kids with elevated blood pressures, elevated sugars. The kids, particularly the ones that participate in football, boxing, or other contact sports, they may have hernias that, if untreated, they can lead into incarcerations, and that's a medical or a surgical emergency. Actually, the hernia gets trapped, and then that can cause severe pain, and if it's not treated immediately, it can get very complicated. So if someone has a hernia, it's best to repair it before they get involved in lifting weights or any contact sports as well. Also, identify and rehabilitate old musculoskeletal injuries. So many of the kids, they want to continue participating. They're very competitive. They may have an injury that they didn't tell mom, dad about. They didn't tell their doctor about it. So it's important for us doctors to talk to the adolescent and tell them, what's going on. How are your knees? Are you having any pain when you participate in the sport? So that's one of the important goals. Head injuries, that's a big one. Many times concussions go untreated because they hit their head. If you don't pass out, no problem. And that's usually what we think, but actually there are very clear guidelines on the treatment of even milder concussions, especially if they happen without any protection, no helmet, that sort of thing. Also, treat or identify conditions that may interfere with their performance, like asthma or exercise-induced asthma or bronchospasms. Some children don't necessarily have asthma and start wheezing just because of allergies, but exercise may trigger that. And there are some questions in the pre-participation physical form that usually you get from your school, from your kid's school, that will go over those questions. And another very important thing is remove unnecessary restrictions on participation. Many times we may restrict the kids from participating for different reasons. And after medical evaluation, we can tell the coach, no, he's good, proper treatment has been established, and they can go ahead and participate without any restrictions. So some examples of these unnecessary restrictions, if there's a suspicion of a heart disease, so sometimes you may have a murmur, what we call an innocent murmur. Many kids can grow out of this murmur. It goes away as they age, as they grow. And many times they may be restricted because of that. Even patients with hypertrophic cardiomyopathy, with proper treatment, can participate in certain sports. Not all sports, but once treated, they can participate. The level of participation is what's going to be up to their primary care doctor or the specialist. If they need specialized care, it's going to be up to them to be determined. And then restricting children also with that are overweight or are suffering from obesity has been also a problem. There is a risk of heat injury when we are overweight. So that's why it's important right now during the summer, try to get your child acclimatized to increase temperatures and heat, proper hydration. Generally we tell our patients, for every hour you're out there, you have to drink at least 16, ideally 32 ounces of water per hour. while you're practicing or exercising or even competing. So that will help the kid get acclimatized to those conditions. So weight should not stop your kid from exercising or participating in these sports. Actually, is restricting it is going to be counterproductive, because this will help, movement will help with the management of our weight, or the kid's weight. So what are the practical considerations when doing this pre-participation physicals and risk assessment? So the timing, okay, we want to do it early on, as I mentioned at the beginning. We want to do it 4 to 6 weeks before the season starts. Let's not wait until August, September. In case something comes up that needs further evaluation or assessment, referrals to a specialist, perhaps, that gives us enough time so that the kid is not left out from participating. That's very important. Frequency. So most guidelines recommend yearly physicals for pre-participation, or if there's going to be an increase in the level of intensity of the sport. Let's say a kid is doing track and then is going to move on to boxing, for example. If there's going to be a severe difference or increase in the level of exercise or physical demand, and it's gonna be important to repeat the pre-participation physical as a precaution. In the setting, so that's going to depend. Some parents decide to bring their adolescents with us, or their children with us here to the office. But some schools also offer the station approach. So you have 4 or 5 healthcare providers at the school that are doing these physicals, and the kids go through different stations to get their different exams and answer different questions. So both of those are acceptable methods, with advantages and disadvantage. The disadvantage of the station approach is that you may not get prompt referrals, or the person doing the examination may not be too familiar with the patient. But it can be a lot more convenient, easier to get in. You don't have to wait for an appointment with your doctor, and so there are pros and cons there. If your child is otherwise healthy, most of the answers on that pre-participation physical form are no. You didn't answer yes to anything. A station approach would be okay. So tell me everything you told the nurse 5 minutes ago. So that's one of the disadvantages of going to the office. You tell the nurse everything that happened, or what you're concerned about, and then the doctor comes in and he asks the same questions again. And the reason we do that is because we want to confirm the information. We want to make sure that the information was documented accurately, and that the information is accurate in the first place as well. So we don't do it just to annoy people. It's for safety. So what are the components of the evaluation? So the one of the main things is going to be that pre-participation physical form, and this is targeted medical and family history, so that we can do a physical examination focusing on the things that are positive or negative, I should say, in that form. You are probably familiar with that form. Is a very busy, kind of blurry slide, but if you have kids, you've probably seen this one. And it's very important, especially, all of the components. There are 21 different components. So 19 for female athletes, 21 for males. And Question 3 focuses a lot on questions it's targeted towards answering questions about heart history. So very important, have you ever been tested for heart conditions? Have you ever passed out during exercise? Have you ever had chest pain? Do you get more tired during exercise than your friends do? So less exercise tolerance. And we have to be careful with this because many times your adolescent or even us as parents, since we want our kids to participate, we may kind of overlook this or say, well, yeah, it's not that bad, we're going to answer no. It's important to have accurate information. It's important to give this information to the doctor. That way they can have a targeted physical exam. As you can see on page 2, then you do a targeted physical exam in that we put notes there if there is or if there are any concerns, and at the bottom we decide, okay, this patient is cleared or cleared with some restrictions or not cleared at all for reason, and we put recommendations. Very rarely, maybe 1 out of 100 kids is not cleared immediately. It's very rare that, at least in my practice, that we have problems like that, provided that the answers were correct, were honest. So all of this, so this form is not, it's where did it come from? So this form has been validated by different medical societies, including the American Academy of Family Physicians, the American Academy of Pediatrics, and the American College of Sports Medicine, and the Medical Society for Sports Medicine. So it's very well validated. The questions are not random. They're very specific to try to identify problems. And again, the heart, the lungs, injuries, all of that is going to be there in that form. So please read and fill out this form before your appointment. It's very important for the doctor. That way, when you come in, you give it to their assistant. That way, your doctor can read it or maybe go over the answers with you afterwards. That way, if there's any other information needed, then they can proceed with that or any further workup as well. Sometimes we get asked by patients because of the hypertrophic cardiomyopathy, should we do an EKG on my son, my daughter? And the answer at this point is no. There's no recommendation for screening in asymptomatic patients, but there's no harm in doing one. The form itself states that an electrocardiogram or EKG is not needed. But if the parent requests it, the doctor can do it. The only problem with that is that may not be covered by insurance and would have to come out of pocket. But it doesn't cause harm doing it, but there's no advantage in doing it either. That's why currently there's no recommendation. So that's all I have today regarding the pre-participation physical evaluation. Very important. Take home points, do it on time. Don't wait until August or September when the season is going to start. Answer the questions honestly. I know we all want our kids to participate and excel at sports, but we also have to be responsible about protecting them. And if we don't provide the accurate and correct information to the doctor or the practitioner performing the evaluation, something may be missed, and that can lead to risk and complications. I'm open to questions or comments at this time. Thank you.